Al Jazeera Podcasts.
Today, inside the epicenter of the Mpox emergency.
Here in the Democratic Republic of Congo, the virus is common, but it's spreading.
The first vaccine shipments have arrived in the DRC, but it's only a fraction of what they need. Why doctors are struggling to manage the rapidly spreading outbreak. I'm Natasha Del Toro, and this is The Take.
It's very, very difficult when you see these people with a severe cases of Mpox. You see people with a skin rash, a severe skin rash, mainly children from the head up to the legs. You see them crying, suffering a lot. We understand that the majority are kids.
Al Jazeera's Alain Uaykani is a journalist based in the DRC. A couple of weeks ago, he visited the South Kivu province in the eastern part of the country, a region embroiled in armed conflict. Alain spent some time there reporting from a clinic treating Mpox patients.
I found myself in front of the severe cases, and it's so severe, even doctors were also affected because they're in contact with these people in a very dire condition. For example, because the area is dire and also dirty in terms of the condition, they didn't have enough means. It's only now that some means are coming.
While the World Health Organization, the WHO, declared Mpox a global public health emergency last month, the vast majority of cases reported have been in the DRC, with 17,500 cases and around 630 deaths since the start of the year. Alain, where are you actually today?
I'm in the town of Goma, the capital city of the North Kivu province in eastern DRC.
So this is a new variant of the virus. It's affecting mostly children, as you say, and it's already a very dire situation because of the conflict and because of a lack of supplies. How are the clinics managing?
That is the main question and the main battle that local doctors, and majority of them, they are not used to this Mpox. First of all, they were not prepared, and also they didn't have, for example, appropriate treatment measures. So they have just to deal with the symptoms, which is the fever. They are attacking the fever, and also they have the skin rash, and then trying to give some drugs which can help the women to wash their kids, to apply it on the skin so that they can stop this skin rash. But unfortunately, the majority of them, according to doctors, they are also coming late to the clinic. They're coming when already those skin rash are in another level, which they have now to deal with the skin rash, and also they have to deal with how to stop the fever from them. But all this in a very difficult condition.
And Alain, tell me, what do I need to know about Mpox? You know, what is it? How does it spread? And how lethal is it?
The Mpox, for the particular case of the DRC, for example, it's caused by the monkeypox virus. The majority of people used to suffer with this are those populations living around the forest, because every morning they wake up, women, children, they go to the bush and they come back with the bush meat from the forest. It's also their meat. They eat it, they share with the family. And then it's transmitted through the contact between people or within infected animals.
The virus, formerly known as monkeypox, can be passed on through close contact and causes flu-like symptoms and lesions on the body and can be deadly.
But with these particular cases here, it's spreading so fast because the victims are those people who are living together. Majority of them are displaced people. You find people, 10, 15 people in the same shelters, and then it's helping for a quick spreading among the population, because these are already people with a very dire condition. And then also the DRC has the version of the most infectious Mpox.
And that's what I wanted to ask you. I know that Mpox isn't new to the DRC. I mean, it's been around for decades, but it's this new variant that's popped up that appears to be much more transmissible between humans.
This new strain is proving more infectious and even more deadly. And experts fear the growing outbreak in Africa could just be the tip of the iceberg.
What do we need to understand about the context of the DRC specifically and why the situation there has gotten so dire?
It's so dire because of the current situation we are having. If you see the place where this Mpox, the two main epicenter of the virus, it is in this area where you have a huge number of displaced people. And why children? Because effectively we have a family living under the shelters with 9 children.
This hospital near Goma in the Democratic Republic of Congo is full of children and young people with Mpox. They're more likely to get it and more likely to die as a result.
I met personally a woman, 2 kids were already under the treatment of Mpox, but she still have another 7 of them in the house. She was obliged to bring the 2 of them at home because doctor said they are now feeling okay, you have to free the place for others. She took the 2 of them. Among the 7 others, those who were already under the shelters in the house, they have to sleep again together. And then even the mother herself ended by being affected by the Mpox. Once they took her to the hospital under the treatment, another daughter also started being sick. And then she lost one who died. When she went to bury that one, the same day evening, another one got sick. So you see all this, it's really showing how the situation is very dire because of what we have already as humanitarian situation. The number is growing because of the contact.
So you're saying that these are people that are in a conflict zone already and they're displaced, they're intense, and that is part of why it's spreading as quickly because they're in these overcrowded places. How worried is the average person about Mpox?
To be honest, the issue right now with the people, it's also around politics. People doesn't have trust in their authorities. People doesn't trust health authorities and political authorities because they know every pandemic, every virus or every outbreak, it is the occasion for people to make money. And then when you talk to people, you say, please, there is a virus, there is this. They are saying, just leave us. This is a political game. People want to get money from WHO. Or WHO want to bring again his international workers here. And all this has reduced the trust of people vis-a-vis any kind of the outbreak which can be declared. And that is exposing more people because politically, people doesn't trust authorities.
After the break, a vaccine for Mpox already exists. So why does the DRC still barely have any? Alain, now there is a vaccine that's available to prevent Mpox. And I know the DRC just received a shipment of 200,000 doses last week. But officials are saying they need around 3 million. So based on your reporting and the people you're talking to, what are the challenges in getting these vaccines?
The main challenge, first of all, is the vaccine itself. This is not a vaccine that DRC is buying. It's given because even the Minister of Health of DRC says clearly that this vaccine is so expensive. If it could be that the DRC has to buy this vaccine, the country need almost like 600 million to buy just some doses, which is impossible for the country for now. So they have to wait for a granted vaccine from a donation from different partners.
There are essentially 2 countries that have promised us vaccines. The first is Japan, and the second is the United States of America. I've just finished, and that's why I apologize for being a little late. I was with the Americans in my office, USAID and the US government, because we were discussing the arrival of those doses.
But the main challenge right now, this is a big country with a big challenge of logistics. This is a country, in the majority of the places, vaccine has to go on the motorcycles. They will have to put the vaccine on the bicycles or even in the boat in other areas. There are people that will not be vaccinated before the next 2 months, even if the vaccine is there. In the remote area of Equateur and Sakuru, where there is also majority of the severe cases, there is totally no any logistic in terms of roads, no any airport. They will need to send helicopters, which we don't have, and that will be another challenge. But people are expecting these vaccines. A lot I've talked to the people, those who are under the treatment. They are really, for the first time, I could see that people are worrying and they are asking for this vaccine. They're even asking when it will come, not only for them, but majority are saying to stop the spreading in their family.
And Alan, a lot of this sounds very familiar to what happened with access to the COVID vaccine. You know, wealthy countries were stockpiling them, and then African countries had to rely on donations. Has anything changed since the COVID pandemic?
Nothing, unfortunately, nothing. We needed to learn even a lesson in how to prepare the country to face such kind of situation. Unfortunately, this is the reality that we have to say it. I said it very clearly here that the majority of this outbreak that we are having in the country, they are endemic. For example, it's not new, but the country didn't make the research to prepare even itself if it comes that the situation could be the way it is right now. DRC could have been a country supplying even the vaccine to others because we have experience. When we talk with doctors in the remote area, they know it, they are familiar to this. But even a national program to train even other doctors to be prepared didn't happen. And this is why we are always surprised when situation is coming. We are running after the event instead of preparing how to tackle the event before. And this is the situation in which the country is living right now, running after the vaccine, while the country should have the vaccine doses in the country because the disease is endemic. It's not something new like it is for other people for now.
And I hear your frustration with the government and the leadership, but, you know, what could the international community be doing? You know, what lessons should other countries have learned by now?
I think the best way for other countries, mainly international community, is to push and to back the country in helping the country to be responsible, to be able to produce vaccine in order to control the disease on the continent. I think the best way should be not only to wait when there is a problem that everybody should run after the event, but they should take measure before and trying to put this country on the capacity, in the level of dealing with the situation and even helping the neighboring with the expertise when there are some situation around them. Because today, if there is Ebola, for example, in Central Africa, there is no country with experience more than DRC to help this country to deal with Ebola. The same case can happen with Rwanda, for example. Rwanda doesn't have experience in Ebola disease than DRC. But how all these are coordinated on the continent in terms of how to prepare, how to have vaccine, how to have capacity of dealing with the situation, this should be the main priority instead of having big meeting, declaration, and then after that, who will help us now with the vaccine? That is, I think it's one of the bad system which we are dealing with time to time. We have problem.
Alan, you've reported on Ebola, you've reported on COVID. You've seen all of the conflict that's happening and people also, you know, fighting this virus, dying from this virus. How does it feel as a reporter to be here again now with Mpox?
It's very tough. It's very tough because I've seen in the last 15 years, I've seen people suffering from different situations in this country. And coming back to the camp today, the same people you filmed yesterday, starving for food, trying to get food, you come and you find the same family, same children now dealing with the body rash, skin rash, and they have to cry. And again, they still don't have food. They have now double challenges. They miss food under the same shelters. And then today, under the same shelters, they're dealing now with the virus. That is the most difficult situation I've seen in the last 15 years. And it totally, when you talk to these people, you feel how it's very difficult for them. And they were even asking me, how can we observe the sanitation measures? How can we? Because our condition is already a dire condition. So when someone is asking me with my 9 children to observe measures to deal with this outbreak, how can I start? So they said the best way for us to observe this peace to go back in our village. We have never heard this in our village. And they are right. You cannot ask to someone. In the shelters, there is no mattress. I've filmed this for many times. There is no mattress in the shelter. There is no any chair to sit on. So there is no electricity under the shelters. When it rains, these kids, their immunity has already decreased because they are under the most of the area in the eastern DRC, so cold. They have been living, suffering already from different disease.
Right.
Because they don't have a protection system. They don't have a proper dressing and this cold temperature that they are going. And now the disease is there. So it's very difficult to see the same people going through different situation for the last 5 years now. And I think it's the most difficult time for them that they are going through, which they are going through for now.
And that's The Take. This episode was produced by Tamara Khandaker, Chloe K. Lee, and Ashish Malhotra, with Amy Walters, Hisham Abu Salah, Hagir Saleh, Duha Mosaad, Shraddha Joshi, and me, Natasha Del Toro. In from Malika Bilal. It was edited by Noor Wazwaz. Our sound designer is Alex Roldan. Joe Plourde mixed this episode. Alexandra Locke is The Take's executive producer, and Ney Alvarez is Al Jazeera's head of audio. We'll be back tomorrow.